So here we are in Fort Myers, Florida. It is June already, 2015. We have a happy patient. You researched this for a little while, didn't you? You were a patient at Kaiser, and you had a posterior vitreous detachment with a central blur, basically, and a bit of a Weiss ring, correct?
Correct. It would float in and out. And I had what I describe as a bat or a bird in my upper left quadrant of my left eye.
Right. And that is the actual typical position of what we call a Weiss ring, which is the former attachment point by the optic nerve. It's usually at the horizontal midline, maybe 20 degrees lateral. And for the vast majority of people, it's not much of an issue, but for some patients it is larger and it does come in your field of vision. And you found it fairly disturbing, correct?
Correct. Mainly the streamers that were hanging off of it.
Right. There were some fibrillar fibers, I guess that is the best way to describe it, as if it was a balled up spider web maybe, or a ball of dust you find
Correct.
Behind your dryer.
Yep.
And at Kaiser, they basically gave you the alternative of living with it, but they said, did they say a vitrectomy was an option?
Vitrectomy was an option only if I insisted upon it. They weren't promoting it at all. In fact, they were trying to dissuade me from going in that direction.
Which is a wise choice, because if you're over 50 years old, a vitrectomy does induce cataract, and it's not without its problems. I'm not anti-vitrectomy, but it does have its issues, and in my experience and opinion, laser is the best first choice. Vitrectomy can always be had after laser, but you can't go vice versa. So you decided to do some research, came all the way from California to me because of my experience and good humor, and you're happy with the result.
That's correct. Very happy with the results. I would say that I am between a 75 and probably 80% clear, if you will, after 3 treatments. Very happy, and did not know of your personality until I got here, and I'm happy to report that the rumors are true.
Well, we try to enjoy our profession. I feel very fortunate to be able to interact with patients who have interesting things to talk about, in trades and experiences and businesses that I'm not always familiar with. I always like to suck information out of people. It amuses me. And it was a pleasure to have you as a patient. And I wish you the best, and your floater is gone.
Thank you, and I will be reporting the success back to my ophthalmologist at Kaiser, at his request, by the way.
Very good. Thank you.